So thank you all for attending today. So I've recently graduated from Curtin University. I graduated in August in a degree in health promotion. So since then I've then taken over the role of COPAHM coordinator. During that time I've been able to talk to quite a few people over the phone, via email and online, and so today I've finally been able to meet a few of you face to face. And I'm looking forward to being able to meet a couple more of you later today or in the near future. So first of all, today I'll be giving you a brief overview of COPAHM, where we started, where we are currently, and our plans for the future of this community. So to begin with, the HIV and Mobility in Australia Roadmap for Action discussion paper was launched in December last year at the Sexual Health Forum. So marking today as a one-year anniversary and a perfect time to reflect on what has been achieved since. The roadmap was a response to increasing HIV diagnosis among people travelling to and from high HIV prevalent countries and highlights 5 areas for action with 71 strategies. So these areas include international leadership, Commonwealth and state leadership, community mobilisation, development of services, and research, surveillance and evaluation. So following the launch, there was a substantial effort to get the roadmap on everyone's radar, and this included a conference in February with Dr. Graham Brown, an article in HIV Australia, HIV and Mobility was an agenda item at the Bloodborne Virus and STI subcommittee meeting, and in March 2015 we were able to secure funding from the WA Department of Health for a network, advocacy network, and this launched the Community of Practice. So in short, this community of practice was developed to keep HIV and mobility issues on the national agenda, ensuring that mobility is part of the ongoing dialogue around HIV and to progress the 5 action areas from the roadmap. The role of COPAHM is to increase partnerships and collaboration among stakeholders and to facilitate policy, research and practice efforts regarding HIV and mobility. So in the beginning, members were nominated by the BBVSS committee and invitations were sent out to join the community of practice. Between April and July, we commenced a mapping activity with COPAHM members to determine momentum on specific strategies identified as being ASAP or urgent in the roadmap. During this time, terms of references were written, a website developed, a Twitter profile set up, and members continued to be invited. So in September this year, we launched the interim report card. This work highlighted areas of strong momentum, such as community mobilisation, and also some areas that are limited in Australia, such as international leadership. During this activity, we received responses from half our members, and I believe a few of you may have taken part, who were able to list 90 activities across the 24 strategies that we identified. The activities listed include existing programs, policy work, services and research. So hopefully by now you've all been able to get your hands on a copy of one of these. However, if not, there is a copy outside, and we do have a soft copy available on the Siren website for you all. So where we are today. So currently we have 74 members from a range of backgrounds across all of Australia. So these include people from government, non-government, research, community groups and national peak bodies. We have a working group that assists us in determining key actions and guide priority settings, and we are currently developing case studies to stimulate further action. We are currently conducting advocacy work with the Bloodborne Virus and STI subcommittee to recommend priority action areas to the Australian Health Protection Principal Committee for inclusion in the second implementation plan for the 7th National HIV Strategy. So these priority action areas, sorry my mouth's really dry, include reforming policies on universal access to HIV treatment and related healthcare for temporary visa holders, including subclass 457 workers and student visas. It includes a whole-of-government approach, including foreign affairs, trade and immigration, paying particular attention to the impact on labour, on mobility and subsequently HIV. To expand strategies to inform and engage gay men and other men who have sex with men, as well as heterosexual men, who have at-risk sex in high HIV prevalent countries. and to standardise surveillance for subpopulations such as gay men and men who have sex with men. Thank you so much. I'm a very nervous public speaker. So to standardise surveillance for subpopulations such as gay men and men who have sex with men, people who inject drugs, sex workers and travellers into and out of Australia, in particular looking at collecting data around country of HIV acquisition, country of birth and co-infections with other bloodborne viruses. And lastly, our priority action is to design studies, monitoring to better understand acquisition risks for different people and to inform the development of prevention, testing and treatment responses. And so also recently we have been able to launch the online portal for a community of practice. So this is an area in which we hope to encourage discussion and collaboration among our COPAHM members. It's a portal which will contain our key documents and a history of all COPAHM activity. And we'll be able to use this to collect data, undertake subgroup work, and we'll use this as a tool to develop future mapping. And so although it is very recent, we have currently an ongoing discussion on surveillance data, with feedback from this discussion going to the Kirby Institute. So looking into next year, which I'm happy to say I'll be continuing on as the COPAHM coordinator, we have a substantial amount of work ahead. We'll continue to map progress against the roadmap for action and conduct a further mapping audit within 6 months, so including all 71 strategies from the roadmap. We'll evaluate COPAHM and the online COPAHM portal. We'll continue to promote, stimulate and support collaboration, action, knowledge sharing and priority settings by COPAHM members. We'll support or initiate development of research studies, including a needs assessment survey of cold populations at risk of HIV next year. We'll continue advocacy efforts around HIV and mobility through opportunities such as conferences, articles, papers, media and social media. And we'll support advocacy efforts to include the roadmap priority actions in the second implementation plan for the 7th National HIV Strategy, with the AHPBC and the BBVSS. So, as you can see behind me, numerous people have contributed to the development of COPAHM. In particular, I would like to acknowledge Anita Lumbus, the previous coordinator, who has done a substantial amount of work with this project. And so for further information, don't hesitate to contact me at the address above. Hopefully by now you're all on Twitter, so any online support is very welcome, and you can follow us at our Twitter handle or use the hashtag HIVmobile. And then to download the roadmap or the interim report card, or for further information about COPAHM, you can visit the Siren website. Thank you.